Hi, I'm Glenn Carolus from International Center for Medical Training. I am super excited and I've been looking forward to the 2025 release of the AHA, American Heart Association resuscitation guidelines. I managed to log in and watch the online version of the release where all the experts and researchers give a presentation basically on the major changes. Unfortunately, I couldn't watch the entire program, and I hope to receive the link as soon as possible to get into it. And then I've been reading quite a bit on the resuscitation statement and the summaries. And most notably, from what I am involved in, the business that I'm involved in is training, community training, public first aid, safety, things like that. And it's been quite interesting to see a specific segment or guideline that deals with first aid. Now, bear in mind, the AHA, American Heart Association, is different from the local first aid accreditation body in South Africa. They are totally different entity. However, with the European Resuscitation Council, they have formed basically this big body of evidence that research all these various components, and not just for first aid, for the medical professionals such as your paramedics, nurses, doctors, and many more. And this is how we basically come about to doing, as you would know, 30 compressions and 2 ventilations. Now, since I will be sharing predominantly what's happening in the public space, I think maybe I'll get a couple of my colleagues and friends within this space as well, just to discuss these things. I hope that they're actually available as soon as possible. If not, I'll give it a go on my own. Nonetheless, it is interesting and exciting, and one of the big things that I've been preaching and sharing with my clients is the ongoing training that you require. So since CPR and first aid things, they are not your daily business, your bread and butter, if I can state it that way. You're a teacher, architect, engineer, whatever profession you may be. Emergency care is not your daily thing, which is fine. Everybody cannot do the same thing. Therefore, it's good actually just to have that space training, and that's one of the key emphasis under the topic of education and training that needs to be done more. So I'm not sure how other organizations and service providers will be doing it. I've been offering it actually for a while now, and one of my things that we've always looked at is maintaining currency, because it's so essential to maintain currency within your skill. If you just think about it, any person playing a specific sport, they need to practice the sport to maintain their skill and improve it. And like the saying goes, if you don't use it, you lose it. Very similar concept. And there are so many other things that the summaries are actually pointing out, even what the knowledge gaps are. And I really would like to tackle those. And I hope this platform will be a bit some form informative, to yourself as our loyal customers, clients, supporters, and the first aid enthusiasts out there. This is the first video recording, and I hope to do so much more. Maybe you can put a face to the name, and I just hope that what we are currently doing in South Africa will be taken to a next level. And even if it's incremental changes, I really think if we start focusing on small aspects, really, it will enhance the education and training in the first aid area specifically. Now, there are changes with regards to the more advanced disciplines, as they call it, like the advanced cardiovascular life support. There's a stroke course as well, advanced stroke care, as well as a pediatric advanced life support. There are changes there that's definitive and so on, because they use a wide variety of medications and monitoring devices, and it's quite intense. Now, first aid is not competing with that. First aid is that immediate interventions that takes place until the patient gets to a definitive care, or you have an emergency care provider, paramedics, ambulance services, fire departments, and depending on what system you find yourself in, can get to the patient and render that level of care. Anyway, I am ending the video right here. Once again, thank you for all the support. It has been tremendous, and we greatly appreciate it. Bye for now, until the next video or the next post.